Protecting your liver. Understanding medications and early warning signs. Be aware that your liver processes every pill, supplement, and food you consume. This vital organ, your body's primary detoxifier, works tirelessly to maintain your health. However, some medications can unfortunately strain the liver. This video highlights 10 medications that may pose a risk to liver health, along with early warning signs of potential liver distress. Learning about these risks can empower you to proactively protect your well-being. 1. Paracetamol. Primary use. Paracetamol, acetaminophen, is a leading global analgesic and antipyretic, widely used due to its safety profile when administered correctly. It's commonly prescribed or available over the counter for symptoms such as headaches, colds, and fever. Hepatotoxicity mechanism. The liver metabolizes paracetamol. At therapeutic doses, most paracetamol is converted into non-toxic metabolites and excreted in urine. However, at high doses or with misuse, the liver's capacity is exceeded, leading to the production of the toxic metabolite NAPQA. NAPQA accumulation causes liver cell damage, potentially resulting in acute hepatitis or acute liver failure. While these risks exist, responsible use ensures paracetamol remains a safe and effective medication. Paracetamol overdose can occur from exceeding the recommended dosage for headache relief. Combining multiple paracetamol-containing medications, such as cold remedies and separate painkillers, without realizing it, or using paracetamol while consuming alcohol, as alcohol impairs liver metabolism. Pre-existing liver disease also significantly increases the risk of paracetamol-related complications. However, by carefully following dosage instructions and being mindful of potential interactions, individuals can safely utilize paracetamol's pain-relieving benefits. 2. Antipsychotics. Risperidone and quetiapine. Atypical antipsychotics are frequently prescribed for managing various mental health disorders, including schizophrenia, bipolar disorder, and treatment-resistant depression. Their popularity stems from their efficacy in symptom control and a reduced incidence of extrapyramidal side effects compared to older antipsychotic medications. Hepatic metabolism of risperidone and quetiapine involves cytochrome P450 enzymes, CYP3A4 and CYPD6. While generally well tolerated, the accumulation of certain metabolites during this process may, in some cases, lead to hepatic inflammation and cellular damage. Drug-induced cholestasis, characterized by impaired bile excretion, can also result in bile stasis within the liver, potentially causing further cellular damage and hepatitis. However, advancements in understanding these metabolic pathways continue to improve treatment strategies and minimize potential hepatic risks. High doses or prolonged use. The risk of liver damage increases with high doses or extended use without medical supervision. However, with careful monitoring, this risk can be mitigated. Pre-existing liver conditions. Individuals with chronic liver disease, cirrhosis, or hepatitis B/C may be more susceptible to liver injury. Yet, with appropriate medical management, many individuals with these conditions can safely use the medication. Drug interactions. Concurrent use with other medications metabolized by CYP450 enzymes, e.g., antifungal agents, macrolide antibiotics, may increase the risk of liver toxicity. However, this risk can often be managed through careful medication selection and monitoring. Alcohol or stimulant use. Alcohol consumption increases the risk of drug-induced liver damage. Abstinence from alcohol is recommended during treatment. 3. Methyldopa. Methyldopa, a centrally acting antihypertensive medication, is widely used in managing hypertension, particularly in pregnant women, where it's considered the safest option. It also proves beneficial for patients with specific health conditions, precluding the use of other antihypertensive agents. Regarding hepatotoxicity, methyldopa undergoes hepatic metabolism and biliary excretion. This process may trigger immune responses or lead to the accumulation of hepatotoxic metabolites. Potential mechanisms of liver injury include drug-induced hepatitis, resulting from an abnormal immune response, and drug-induced cholestasis, characterized by impaired bile flow and subsequent biliary stasis, causing hepatic damage. Methyldopa carries a low risk of liver damage, affecting 0.5% of users. Potential liver effects include acute hepatitis, manifesting as rapid-onset liver injury within weeks to 3 months of treatment initiation. Chronic hepatitis, a persistent condition if the medication is continued undetected. and cholestatic jaundice, characterized by impaired bile flow, resulting in jaundice, itching, and elevated bilirubin levels. Early detection and appropriate management significantly mitigate these risks. Long-term use. The risk of complications increases with prolonged methyldopa use without monitoring. Pre-existing liver conditions. Individuals with a history of hepatitis, cirrhosis, or other liver diseases should exercise caution. Age. Older adults may be at a higher risk of liver damage due to reduced hepatic metabolic capacity. However, with careful monitoring and appropriate management, the benefits of methyldopa can often outweigh these risks. 4 antifungals. Fluconazole and itraconazole, azole antifungal agents, are widely used to treat and prevent fungal infections. Fluconazole effectively combats candida infections, vaginal, esophageal, and systemic candidiasis, and cryptococcal meningitis. Itraconazole is highly effective against dermatomycoses, onychomycosis, and systemic fungal infections, such as aspergillosis. Both medications achieve their therapeutic effect by inhibiting the synthesis of essential fungal cell membrane components, offering promising treatment options for a range of fungal diseases. Fluconazole and itraconazole are metabolized and eliminated by the liver. While they can potentially cause liver damage through mechanisms such as cytochrome P450 enzyme inhibition, leading to increased toxic substance accumulation and the accumulation of potentially hepatotoxic metabolites, it's important to note that the body typically manages these processes effectively. In rare instances, an individual may experience an unusual immune response resulting in hepatitis. However, advancements in medical understanding and treatment options offer positive outcomes for patients. High doses or prolonged use. The risk of liver injury increases with extended use or high dosages. Pre-existing liver conditions. Individuals with chronic hepatitis, cirrhosis, or a history of drug-induced liver injury are at higher risk. Drug interactions. Concurrent use with medications metabolized via cytochrome P450, e.g., antipsychotics, statins, may increase the risk of liver damage. Advanced age and comorbidities. Older adults or those with underlying conditions such as diabetes or renal impairment may be more susceptible to liver injury. However, with careful monitoring and appropriate management, these risks can be mitigated. 5. Methotrexate. Methotrexate is a crucial medication widely used in treating various conditions, offering significant therapeutic benefits. In rheumatoid arthritis and psoriatic arthritis, it effectively reduces inflammation and prevents joint damage. For psoriasis, it alleviates symptoms and helps manage the disease effectively. Furthermore, methotrexate plays a vital role in cancer treatment, particularly acute lymphoblastic leukemia and other specific cancers. Its mechanism of action involves inhibiting dihydrofolate reductase, thus reducing DNA synthesis and cell division. This process successfully curtails the proliferation of abnormal cells, such as cancerous or inflammatory cells, leading to improved patient outcomes. Methotrexate is metabolized in the liver and excreted via bile or urine. This process may lead to the accumulation of methotrexate or its toxic metabolites in the liver, potentially causing inflammation and hepatocellular damage. It may also suppress liver cell regeneration, making the liver more susceptible to injury from other agents. Methotrexate can cause 2 main types of liver damage: acute hepatitis, a rapid onset of injury during treatment, and fibrosis or cirrhosis, a long-term complication from prolonged use. However, with careful monitoring and management, these risks can be mitigated, allowing for the continued safe and effective use of methotrexate. Dosage and duration. The risk of liver complications increases with high doses or prolonged treatment over many years. Pre-existing liver conditions. Patients with a history of hepatitis, fatty liver disease, or cirrhosis should be closely monitored. Alcohol consumption. Alcohol consumption increases the hepatotoxicity of methotrexate. Folic acid deficiency. Methotrexate depletes folic acid, a crucial factor in liver cell regeneration. Drug interactions. Concomitant use of medications such as NSAIDs, antibiotics, or other hepatotoxic drugs elevates the risk of liver damage. However, with careful monitoring and management, these risks can be mitigated. 6. Anticonvulsants. Anticonvulsant medications, including phenytoin, valproic acid, carbamazepine, and lamotrigine, offer effective treatment options for a range of neurological conditions. These medications are frequently used to reduce the frequency and severity of seizures in epilepsy. Furthermore, valproic acid and lamotrigine are valuable in mood stabilization for individuals with bipolar disorder. In certain cases, carbamazepine may also provide relief from trigeminal neuralgia. These anticonvulsant medications are primarily metabolized by the liver via cytochrome P450 enzymes. During this metabolic process, intermediate products may cause hepatotoxicity. Some medications, particularly valproic acid, can induce lipid accumulation in the liver, leading to hepatic steatosis and cellular damage. However, with careful monitoring and management, the liver's remarkable regenerative capacity often allows for recovery. While rare, idiosyncratic immune responses to these medications can cause acute or chronic hepatitis. Advances in medical understanding and treatment strategies continue to improve patient outcomes. High doses or prolonged use. The risk of liver damage increases with high doses or prolonged use without monitoring. Pre-existing liver disease. Individuals with chronic hepatitis, cirrhosis, or a history of liver damage are at increased risk. Concomitant medication use. The use of multiple anticonvulsants or other hepatotoxic drugs elevates risk. Children and the elderly. Children using valproic acid have a higher risk of developing a Ray's-like syndrome. Elderly individuals are at increased risk of liver damage due to decreased liver function. However, with careful monitoring and appropriate management, these risks can be mitigated. 7. Allopurinol. Allopurinol is a widely used medication for treating and preventing gout by lowering uric acid levels in the blood and preventing the formation of urate crystals in the joints. It also helps prevent uric acid kidney stones and inhibits the surge in uric acid during cancer treatment, tumor lysis syndrome. This beneficial effect is achieved by inhibiting xanthine oxidase, thus reducing uric acid production. Allopurinol is metabolized in the liver and excreted by the kidneys. In rare instances, the drug or its metabolites may cause liver damage through several mechanisms. Immune responses, where some individuals experience an atypical reaction leading to hepatitis, or direct hepatotoxicity, resulting from the accumulation of toxic metabolites. However, advancements in medical understanding and treatment offer hope for managing these potential side effects effectively. Liver disease history. Individuals with chronic hepatitis, cirrhosis, or fatty liver disease. Impaired renal function. Reduced kidney function slows allopurinol excretion, leading to drug accumulation. High dosage. Use of high doses without monitoring liver and kidney function. Drug interactions. Concurrent use with other hepatotoxic drugs. Genetic predisposition. Some individuals with a specific gene mutation have a higher risk of allopurinol hypersensitivity syndrome, particularly those of Asian descent. However, with careful monitoring and appropriate management, the risks associated with allopurinol can be mitigated. 8. Amiodarone. Amiodarone, a widely used antiarrhythmic drug, effectively treats atrial fibrillation and flutter, controlling irregular heartbeats, and also ventricular tachycardia and other dangerous arrhythmias. Its efficacy is particularly notable in stabilizing heart rhythms in both acute and chronic cases. Regarding hepatotoxicity, amiodarone undergoes hepatic metabolism via cytochrome P450 enzymes, producing metabolites potentially toxic to liver cells. These metabolites may accumulate, triggering inflammation, hepatitis, lipid accumulation, leading to non-alcoholic fatty liver disease, or NAFLD, and mitochondrial dysfunction, impairing the liver's regenerative capacity. However, with careful monitoring and management, the benefits of amiodarone often outweigh these potential risks. Acute hepatitis. This may occur within weeks or months of starting medication, presenting with elevated liver enzymes, ALT, AST, and symptoms such as jaundice and fatigue. Non-alcoholic fatty liver disease, NAFLD. Lipid accumulation in the liver causes inflammation and damage to liver cells. However, with proper management, progression to fibrosis or cirrhosis can be avoided. Cirrhosis. While prolonged medication use can lead to irreversible liver damage, early diagnosis and treatment offer positive outcomes. Chronic hepatitis. In rare cases, liver damage may persist and progress even after medication cessation. Nevertheless, advancements in treatment provide hope for improved liver health. Extended use. Prolonged use increases the risk of drug accumulation in the liver, particularly after 6 months. Higher doses. Elevated dosages heighten the risk of toxic metabolite accumulation. Pre-existing liver conditions. Individuals with chronic hepatitis, cirrhosis, or fatty liver disease are at increased risk of liver damage. Advanced age. Older adults with their naturally reduced liver function are more susceptible to adverse effects. Alcohol consumption. Alcohol consumption increases the liver's metabolic burden, potentially leading to more significant damage. However, with careful monitoring and appropriate management, these risks can be mitigated. 9. Amoxicillin with clavulanate. Amoxicillin clavulanate is a combination antibiotic effectively combating bacterial infections. Amoxicillin, a penicillin group antibiotic, inhibits bacterial cell wall synthesis, leading to bacterial destruction. Clavulanate protects amoxicillin from breakdown by beta-lactamase enzymes produced by resistant bacteria, thus enhancing its effectiveness. This powerful combination is frequently prescribed for a range of infections, including respiratory tract infections, sinusitis, pneumonia, bronchitis, middle ear infections, skin infections, and urinary tract infections. The positive impact of this treatment offers patients a promising path to recovery. The medication undergoes hepatic metabolism and may cause liver injury through several mechanisms. Immune responses, where some individuals develop hypersensitivity reactions to clavulanate or amoxicillin, leading to hepatitis. Drug-induced cholestasis, disrupting bile flow from the liver, causing bile stasis and hepatocellular damage. And direct hepatocellular injury, where certain drug metabolites can induce inflammation and damage to liver cells. Regarding amoxicillin clavulanate-associated liver injury, acute hepatitis, manifesting as elevated liver enzymes, ALT, AST, jaundice, and cholestatic symptoms, typically appears within days to weeks of medication use. Chronic cholestasis may occur in some cases, persisting after medication cessation and potentially leading to liver fibrosis, if not promptly addressed. While rare, drug-induced autoimmune hepatitis is also a possibility in susceptible individuals. However, with prompt diagnosis and appropriate management, positive outcomes are achievable. Liver disease history. Individuals with chronic hepatitis, cirrhosis, or underlying liver conditions. Advanced age. Older adults are at a higher risk of liver damage due to reduced drug metabolism capacity. High or prolonged dosage. High doses or prolonged use without monitoring. Drug interactions. Concurrent use with other hepatotoxic drugs. Individual susceptibility. Some individuals may be at increased risk due to genetic factors or sensitivity to clavulanate. However, with careful monitoring and appropriate management, these risks can be mitigated. 10. Diclofenac acetaminophen, also known as paracetamol, is a leading global analgesic and antipyretic, renowned for its safety profile when administered correctly. Its primary applications include the effective management of headaches, muscle aches, toothaches, fever, and mild to moderate pain. It is widely available both with and without a prescription. Paracetamol undergoes hepatic metabolism via two pathways. A primary, safe pathway, utilizing liver enzymes to produce harmless metabolites excreted in urine, and a secondary, risky pathway, where a small fraction is metabolized into the potentially toxic NAPQI, N-acetyl P-benzoquinone imine. At therapeutic doses, NAPQI is neutralized by hepatic glutathione, posing no harm. However, at high doses or with misuse, glutathione depletion allows NAPQI accumulation, potentially causing liver cell damage. Regarding paracetamol-related liver injury, acute hepatitis can occur with paracetamol overdose, potentially leading to acute liver failure if left untreated. Acute liver failure due to paracetamol is a leading cause of this condition globally. However, with prompt medical intervention, including liver transplantation in severe cases, positive outcomes are achievable. High or excessive doses. Adults, consuming over 4,000 milligrams per day or a single dose of 7,500 milligrams may pose a risk. Children, the hazardous dose varies depending on weight. Prolonged use, continuous daily use without breaks. Alcohol interaction. Alcohol increases NAPQI production and reduces the liver's ability to neutralize it. Concurrent use of multiple paracetamol-containing medications, for example, analgesics, cold medications, and antipyretics. Pre-existing liver conditions. Individuals with chronic hepatitis, cirrhosis, or a history of liver disease, early symptoms, 0 to 24 hours post-overdose, nausea, vomiting, and loss of appetite. Abdominal pain, particularly in the right hypochondrium liver region. Later symptoms, 24 to 72 hours, jaundice due to increased bilirubin, dark urine, and pale stools. increased right hypochondrium pain, fatigue and confusion. In cases of acute liver failure 72 hours onwards, bleeding and coagulation disorders, confusion and hepatic coma. While serious, with prompt medical attention, including liver transplantation if necessary, a full recovery is possible. The liver, a vital organ, works tirelessly to maintain bodily health. However, even this remarkable organ has limitations. Protecting liver health involves understanding medications that may pose risks and recognizing early warning signs of damage. Sharing this valuable information with others who may benefit is encouraged. To receive future health advice, please subscribe to our channel. We look forward to seeing you in our next video and wish you continued well-being.